Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be talking with Dr. Maureen Hecker-Rodriguez, who will discuss the signs and symptoms of allergies. Suzanne Whitaker, who will be talking about the importance of walking to heart health and the American Heart Association's upcoming Heart Ball. And owner and chef Diana Kanawati, who will be talking about the delicious and healthy Mediterranean fare at a tiki bar and grill in the French Quarter. So don't go away, we'll be right back with more Community Health Heroes.
My mother shaped me as an actor, as a musician, as a human being. So when she was diagnosed with colon cancer, it was like our entire family got cancer. And she died when she was only 56, so this is personal. And hopefully my heartbreak is your wake-up call. You can prevent colorectal cancer. If you're 50 or older, get screened. Screening saves lives.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat.
Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Welcome back to Community Health Heroes. Spring has sprung and so has allergy season. Do you know the difference between allergies and a cold? Joining us today to discuss what you can do to prevent and treat allergies in yourself and your family members is Dr. Maureen Hecker-Rodriguez, internal medicine physician with Crescent City Physicians. Welcome to the show, Dr. Hecker.
Thank you for having me.
So I understand you're going to tell us a little bit about allergies today.
Sure. I'll be glad to talk about allergies. It's a very common, prevalent thing here in New Orleans.
Is there a seasonality to the allergies, or is it pretty much all year?
It's yearly, but the springtime is probably the worst time with all the pollen. You'll notice cars are going to be covered with pollen at this time of year, and people are having a lot more issues in the early spring. Also, summer is another issue, as well as fall. Winter, not quite so bad, but there is still some prevalence of allergies during the winter time.
So probably in the wintertime it's more like environmental allergies, like things inside your house, or what's going on?
Well, it's home as well as environmental outside. When you have wintertime, the leaves have fallen, so we create a lot of mold.
Oh, okay.
So it's more mold driven in the wintertime and more pollen driven in the springtime.
And what are some of the signs and symptoms people can experience with allergies?
Oh, they can range a whole facet of symptoms, but the majority of patients are going to have itchy, watery eyes. They're going to be very congested. They're going to feel like they have a cold. Kind of the difference between a cold and allergies is that, your colds are going to be more of a thicker sputum, where your allergies are going to be thinner, you're going to be very congested. You usually don't see a fever with allergies. That's kind of one of the hallmarks, that if you're having symptoms, you're not running fever, it's more clear, a little bit whitish, that's probably more allergy related than an actual cold.
And what can you do about all these symptoms?
Well, you can treat with over-the-counter agents. First thing you need to do is make sure that you don't have any underlying medical conditions before you use them. But antihistamines are probably the forefront of allergy relief. And if you look at histamines, what histamines do is they cause these allergic reactions. And in the nose, you have these mucous membranes that get just very swollen and people can't breathe. So the antihistamines help with decreasing the histamine response. And then you can use other things like decongestants. There's nasal decongestants, oral decongestants. Those you have to be careful if you have a history of things like heart disease or high blood pressure before you use those. Even simple as saline washes can help. Salt water helps to reduce inflammation.
So if you do have like high blood pressure or a medical condition, you really should talk to your doctor before taking any
Correct,
over-the-counter
but
medicines.
there are cortisone and HPP is one thing you can get over the counter that people can use when they have high blood pressure. So it's you can start a little bit, but you shouldn't self-treat. If you notice your blood pressure is going up, consult your doctor.
And is there something like adult onset allergies, or is that a myth?
Anybody can get allergies, even children, but it takes years of exposure for you to really have problems with allergies. There's a genetic component to allergies. If your parents had problems with allergies, most likely you're going to have problems as well. So some people may not be in an environment that they're having triggers all the time, and so yes, you actually can get it as an adult or as a child too.
So can you tell me, recently in the news, there's been a lot about gluten intolerance, gluten allergies. Can you explain that?
Well, there's a disease called celiac where you actually have a true allergy to gluten products, and gluten also rolls over to oats and brands and things as well. But most of the patients that we find are what we call gluten sensitive, where they eat products that have gluten related items and then they start having symptoms. So it is a true phenomenon that we're seeing, and there's a lot of research actually being done at Stanford. There's actually a lot of oligosaccharides that are being blamed, which are sugars that come from the different food items. So we're going to see more information coming out on that.
What should you do if you think you're gluten sensitive?
Well, you avoid gluten, which is a very difficult diet to follow because you're not just dealing with wheat, you're dealing with, oats and barley. So you have to read every single label. It's difficult to go out and eat because you don't have control of your foods. You have to, if you're a beer drinker, you have to be careful because they use barley and oats in beer. So, things that you think are benign, even something like soy sauce can contain wheat, but there are wheat-free formulas. If it is truly gluten-free, they will be labeled gluten-free.
Yeah, I'm seeing that more and more in the grocery
Correct.
stores, that they actually have gluten-free sections, and things are more labeled more clearly nowadays.
Right.
And what about children? Kids obviously can get allergies. What do you do with a child that has allergies?
Well, I treat adults predominantly,
Okay.
but with children, if you can find out their triggers and avoid their triggers. The biggest thing, if it's an environmental allergy, is, don't go outside between 4 a.m. and 10 a.m. That's your biggest high pollen times. Keep your windows closed. Use your air conditioner and try not to use your fan because what you're doing is you're blowing the spores around.
Great.
Change your air filters frequently. And, a lot of allergies are related to molds. Dehumidifying your home a little bit. We have so much humidity here that we just grow mold very easily.
And what about allergies in the workplace? What can you do about that?
Well, try to find the trigger, and then if you can remove yourself from that trigger, sometimes it's difficult. If you have to work, you may have to take things like antihistamines to go to work, decongestants, those kind of things.
And is there a place where we can find more information about allergies?
The internet's a great source. You can Google allergies in general if you want to look at adults, children, environmental triggers, things like that. You get a lot of information that way.
All right, and how can we find you?
I am over at Crescent City Physicians, located across the street from Turo, and always looking for patients. I treat lots of allergies. I treat adult medicine.
Well, I really appreciate you being on the show and providing all this information to us.
Thank you for having me.
When we return, we'll be speaking with Suzanne Whitaker, the American Heart Association, who'll be talking about National Walking Day and the American Heart Association Gala coming in May. So don't go away. We'll be right back with more Community Health Heroes.
Hi, I'm Kathy Ireland. I enjoy great careers in fashion, design, and business. The most important responsibilities to me are being a wife and mother to my family. We all need to be here for our families, so please let's do our best to stay healthy. And at my age, that means getting screened for colon cancer. Colon cancer claims the lives of 50,000 men and women each year, but it doesn't have to. Colon cancer can often be prevented or caught early through screening. If you are 50 or over, or have a family history of colon cancer, please talk with your doctor about getting screened. It could save your life. I got screened. Did you? For more information, please visit screenforcoloncancer.org. Thank you.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers. His first pitch is fouled to the back.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Joining us today to talk about the importance of walking to our heart health and the Heart Association's upcoming ball is Suzanne Whitaker with the American Heart Association. Welcome to the show, Suzanne.
Thank you.
So recently we had National Walking Day. Can you tell me a little bit about the event?
Oh, sure, would be happy to. April 1st is National Walking Day, and the American Heart Association started it as a way to bring awareness to the general population that walking just 30 minutes a day can greatly improve your cardiovascular health.
So it can lower your blood pressure, lower your stress level, things like that?
Absolutely, and even help work on your cholesterol levels as well.
So what did you guys do for National Walking Day this year?
Well, we held an event and we called people out to come join us and walk and to help bring awareness to the fact that exercise is a very important ingredient in a healthy lifestyle.
And just something as simple as 30 minutes a day?
That's right.
Can you break that up?
Sure, absolutely. You can do 10-minute increments, 15-minute increments, whatever works for you, but it's important to get 30 minutes at least every day of exercise to help your cardiovascular health.
And I understand you have another event coming up soon?
We do, the annual Heart Ball, which is going to be May 16th at the Hyatt Regency in New Orleans, and that is our main vehicle for fundraising. That's the way we bring money in for research, for CPR training, for the community research on heart disease, and actually also to continue to bring awareness to the fact that heart disease is the #1 killer of both men and women nationally.
Mm-hmm. And if I was curious about how to get information on the annual ball, how do I go about getting that information?
Well, you can go to our website at heart.org/New Orleans Heart Ball, or you can certainly call us at 504-830-2300.
And is there anything else you'd like to share with us today?
That we're very glad to have this opportunity to bring awareness about heart disease, and we hope that we can continue to spread the education about the fact that heart disease can be prevented with a healthy lifestyle. But if you are indeed diagnosed with heart disease, we have a wonderful set of resources for you to help manage your condition.
So you can find information on your website about how to manage your high blood pressure, your cholesterol?
Yes, you can. You just need to visit the Heart Association website.
Well, I really appreciate you being on the show today, Suzanne.
Thank you. I appreciate being here.
When we come back, we'll be in the kitchen with owner and chef Diana Kanawati of a Tiki Bar and Grill. So don't go away. There's more Community Health Heroes.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities. To ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give. Advocate. Volunteer.
Live united. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Each year, loving parents and caregivers cause serious injury and even death to infants by allowing unsafe sleeping conditions. Never sleep with your baby on a sofa, in a chair, or in an adult bed. Don't allow the baby you love to be the next tragic statistic. The only safe place for your baby to sleep is on its back in a crib. For more information, visit cribsforkids.org.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 50 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu. We make it easy for you to dine at your favorite New Orleans restaurants, guilt-free. Every month, the Community Health Heroes Show shines a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining in their restaurant or any of our other great Eat Fit NOLA restaurants. So don't go away. Community Health Heroes will be right back with our Eat Fit NOLA cooking segment.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
This is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. When I say dot, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you come.
Here we go.
Good job.
Thank you. Thank you. And I did it by myself. Feel smarter.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Joining us for today's Eat Fit NOLA cooking segment is owner and chef Diana Kanawati of a Tiki Bar and Grill, who's going to show us what's on the menu for the health-minded guests in the French Quarter restaurant. Thanks so much for joining us today, Chef.
Hi, thank you for having me.
So what are you preparing today?
Well, we're preparing today, it's a chicken shawarma, and instead of serving it, which is one of our popular items, instead of serving it in a wrap of pita bread, we're serving it with a lettuce wrap, which is, it fits the Eat Fit NOLA criteria. It's very healthy, and it's one of our popular items on the Eat Fit NOLA menu. It's served with iceberg lettuce, with Mediterranean chicken marinated in our spice. And then on the side we have fresh veggies, whatever we have, if we have like asparagus or broccoli.
What about how many calories would you say is in this dish?
The lettuce wrap, I would say no more than 600 calories.
Okay.
It's very low in sodium, and it's low in no white carbs, very low in saturated fat. Everything, you know, that we cook with as a Mediterranean cuisine, it's basically like olive oils, and we cook with garlic and a lot of healthy stuff.
So tell me, what are some of these things on this plate here? This
Okay.
beautiful plate of, it looks like herbs and spices.
Yes, this is fresh chopped garlic. We have kosher salt, sumac that we use a lot. It's it has kind of like a lemony taste. Of course, sun-dried tomatoes. We cook a lot, you know, with it as well. and fresh parsley that we use all the time.
And so a lot of people believe that the Mediterranean diet is healthier than some other diets. Why is that so?
Because we're always cooking with fresh ingredients. It's very hard to kind of pre-make or buy it already made.
There's not a lot of processed foods. This is all fresh ingredients.
Correct. I mean, you can. There is some that takes a shortcut, but you know, you can tell. You know, when you're dealing with fresh ingredients and so forth.
And tell me about this beautiful chicken. You said you had marinated it. What did you marinate it in?
We marinate it with our spices, which is it's like a 7 spice. It's like with curry, cumin, you know, kosher salt, olive oil, little lemon juice, paprika, and you know, those are kind of the ingredients that we use, you know, mostly in our food. And the more it marinates and the more it sits there, the more it has that flavors.
Okay,
you know,
great.
the Mediterranean flavors. And so what we're gonna do is our lettuce wrap. We have everything done here, and see, like it doesn't take a lot of time at all to, you know, when you're home and you just cook up the veggies and so forth. They're simple things.
So we're going to start with the lettuce, and we put a little bit of hummus in the
Correct.
center?
This is, you know, instead of doing the pita and your normally, you know, we put the hummus on a pita. We're putting it and spreading it out on the lettuce. An iceberg lettuce works out really fine with this because it kind of works as a bowl.
A bowl, correct.
Yeah. And we have here the chicken that we grilled. Has been marinated.
And do you know about how many items are on your menu that are Eat Fit NOLA approved?
Yes. We have actually at least 10 items.
Oh, wow, that's a lot.
Yeah. From salads to the proteins to the salmon to we have the filet and yeah.
And in your restaurant, can you tell whether you're getting more locals or more visitors or a mixture of both?
Mixture of both. We get a lot of repeats, a lot of locals that, you know, had gotten used to us and as well, you know, wanted something different, and also a lot of tourists that are familiar with Mediterranean, and they come, you know, they eat, they love the New Orleans food, and then they say, okay, we want something different.
I need to slow down a little bit.
Exactly. So we have the iceberg lettuce, and then we put the hummus with the chicken, and then we top it off with a Mediterranean salad. Everything is chopped, you know, fine, which is the cucumbers, onions, tomatoes. We'll put a pinch of kosher salt. Got to put less for Eat Fit NOLA. You know, people watch our sodium. Fresh parsley. And like I said, everything we do is always
fresh.
Olive oil and lemon juice. We use that in everything. A little lemon juice.
So how long have you been in business?
10 years.
Oh, wow, that's long. Same location?
Same location, yes. It's been pretty exciting.
That's a long time. So if our guests wanted to find you, where would they find you at in the French Quarter?
We actually, we got to be, you know, pretty well known with the locals, and other restaurants with hotels, everything else. We have built up a great relationship with everybody in the French Quarter, and basically they can just ask around, Google where's the Mediterranean place, and we're 2 blocks away from Canal and
so you're right there on Decatur?
On Decatur, across House of Blues.
Across from the House of Blues, all righty.
Then we're going to top it off with
your Mediterranean
chopped
salad. Beautiful.
That's good. And then we're going to add sesame sauce. This is, you know, made out of sesame, and again, we put a little olive oil, lemon juice. And then we
What
top
gives it
up.
though like white consistency? Is there any yogurt in it?
No, this is just pure sesame.
Okay.
You know, sesame, like sesame seeds,
Right,
sesame
the white
oil.
sesame,
the
right.
sesame oil. And it comes like really thick, and everybody has their own consistency to do it. So we do it like in between. That some people don't like it too thick and too watery. So we add a little of that. We add some sumac on top.
Beautiful. And then you're going to serve with the side of sauteed veggies.
Correct. Sauteed fresh veggies. Broccoli.
Well, Chef Diane, this is absolutely beautiful, very colorful, smells delicious, and I
Thank
really appreciate you
you.
taking the time to be on our show today.
I appreciate you guys having me here. Thank you so much.
Thank you so much,
Thank
Chef
you.
Diana. Join us next time for another great Eat Fit NOLA cooking segment, and we'll be right back with more Community Health Heroes.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Here we go. We're gonna make some juice.
It's gonna
You
be
ready?
good.
She's excited. A little bit of kale.
Please don't put this on
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Packers. Vikings.
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. We hope that the information provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.